Louisiana is currently experiencing one of the worst COVID outbreaks in the world.
If you're staying in here, I'm going to give this to her. I think that's all we need for the intubation. Honestly, we don't need all these people exposed. So some of y'all need to come out.
Only 38% of its population is fully vaccinated. That's leaving the community vulnerable as the highly contagious Delta variant continues to spread rapidly. As recently as late June, Louisiana was reporting under 300 new COVID cases per day. Now, that number's risen to over 5,000.
This is the state's largest hospital, and they're not out of beds, but they are out of staff to care for patients. They've been supplemented for the last 2 weeks by staff from the National Disaster Medical System. That includes physician assistants, nurse practitioners, nurses, doctors, a variety of other support staff from what's essentially the National Guard for Medicine. Normally, the National Disaster Medical System is responsible for staffing disaster sites, hurricanes, earthquakes, wildfires, but in this case, the disaster is the uncontrolled infectious disease spread here in Louisiana and elsewhere in the country.
Our team has been able to assist with opening 6 additional ICU beds. They're having a significant staffing issue, so our team is working in conjunction with theirs to open those 6 additional beds to get more critical patients taken care of. I have been an ERPA for over 10 years of my 22-year career, and in my entire career I have never seen this many drips hanging on patients in the entire unit. So that is a very bad sign as far as the severity of their illness, and it's every single patient.
Bren Engel, a registered nurse, has been deployed more than a dozen times since the beginning of 2020.
It is starting to wear people out, because I've been doing this for 18 months and I've seen people just do 1 or 2 missions that are just tore up over it, because it's very emotional watching people die every day. I was in charge of a code resuscitation team in Texas, and it was our normal day to have 10 to 15 codes a day. And you start seeing the same look on their face where their eyes are bugging out and they're grabbing at you, don't let me die, don't let me die. And all you can do is intubate them and hope for the best.
If Louisiana didn't have such a low vaccination rate, it's likely they wouldn't have needed backup from the federal government.
I think we have to remember that people do make mistakes and they shouldn't be punished for them. I think having COVID is a huge punishment, basically, for the mistake that they have. I had somebody who very close to my age, you know, I could have been her, except I was vaccinated and I haven't gotten COVID, but she was otherwise me, and she's dead.
I've had several patients, even before I came to Baton Rouge, who have said to me, you know, I wish I had gotten the vaccine. I should have listened. I just thought that it wouldn't have hit me. But that's the way a lot of people think. It won't happen to me, and when it does, it's too late.